Hi, my name is Rob Lilly and I'm the director of Lilly Inspired Training, and today we're going to talk a little bit about high hamstring tendinopathy, basically where the top of the hamstring feels really uncomfortable, and or low back pain. We're going to show you exercises that will kind of help all these areas to feel better, and we're going to start with basic foam rolling. Hello, Bobby. We're going to do a little bit of foam rolling where Bobby is going to have to start his glute right on the foam roller. And he's gonna roll just over top of his glute. You'll notice that his left leg is in a figure four, what we call figure four, so his left foot's on top of his right knee, but he's just rolling over top of the actual glute muscle as the foam roller pushes against him. Then he's gonna roll to kind of the top of the hamstring, so we'll go down a little bit more. That's kind of the middle of the hamstring, so Bobby's gonna go the middle first. Okay, that's fine. Yep, let's do the top of the hamstring first. Then now he's gonna foam roll across the top of the hamstring. He's gonna go side to side. So we're trying to work on his muscle right through here where he's having some tightness. This will help to bring some flexibility to the hamstring and also allow us to open up the glute so that his low back won't hurt as much, especially down in the lower part, and then his glute won't hurt as much if he's having some glute pain. Okay, so we do side to side foam rolling, which we call cross striation foam rolling. And then we also will do up and down foam rolling with the hamstring. So we just go forward and backward, which is just a good way to bring blood flow to the area. Good job, Bobby. So that's foam rolling. If you wanted to, for just the last picture, you can do lower hamstring where you're gonna foam roll side to side. Same thing you just did, you were gonna show us initially. So he's going side to side on the foam roller, rolling all the way over to his IT band. Very good, okay. Now Annie's gonna show us another way to get our hamstring opened up. So she's gonna pull her knee toward her chest. Let's just start with that first. So this position where she pulls her knee toward her chest is gonna basically stretch out the hamstring without doing anything else. It'll stretch out her glute and her lower back. And then from this position, she's gonna hold her hamstring near her chest. So, well, it's gonna keep her thigh near her chest, but she has her hamstring held. And then she's gonna straighten her leg. But notice that her leg doesn't go actual straight. We're just straightening it out the best we can. And then what will happen is she's gonna get a little bit of shaking in her foot because we're getting the hamstring to be actively stretching. So then she's gonna bring her heel back down. And then we'll go back up again where she brings her leg back up. We're gonna do this 3 to 5 times. I'm not gonna video all 5 times, but you'll notice that Annie is pulling against her hamstring, bringing her quad or thigh toward her chest, and then she's straightening her leg. She's not moved her knee or her hamstring at all. In other words, her pulling down stays in the same position. Another exercise we do oftentimes for low back, glutes, and hamstrings is legs up the wall, which is what Bobby's doing here. So he literally just has his bottom next to the wall and his legs up. One thing we can do that's gonna help with our backside is pull a toe toward our knees. When we do that, you'll notice Bobby's knees bent. A lot of people's knees won't bend. Mine do as well, but basically we're stretching out the hamstring and the calf, and then he's gonna relax his toes. He's gonna point them up at the ceiling. Good job, that's gonna get the front shin muscle opened up, and since we're just in the mix of getting all of our leg muscles feeling better, that's why we're doing this. And he's gonna pull his toes toward his nose. We have a whole leg kind of body up against the wall exercise routine we do. This one is just kind of the beginning pieces. And then I'm gonna have him take his right leg. So if his right hip, hamstring, glute, or low back is hurting, we're gonna have him go into this figure of an L. It's like an L shape, like a capital L. And so this is gonna stretch out. I'm gonna have you point these out for me, Bobby, kind of in like the middle of the muscle, but we're gonna stretch out his groin, or what's called his adductor, which is right there. He's gonna end up stretching out his glute. He doesn't have to point to his glute, but his butt is getting stretched out. And then where your pants come into your shirt, can you just show us kind of the low back portion of where you're stretching? Yep, you're gonna get low back on both sides is getting stretched. So we're getting low back, yep, hip, hamstring, and our adductor muscle, which is also your groin. Good. And then the last thing we do for low back, not the last thing, but certainly something that'll help, is we go into child's pose, which is gonna stretch out the low back. And Annie's in child's pose now, which is gonna basically stretch out everything from her rib cage down to kind of the top part of her hamstring. We'll have you stand up out of that for a minute, Annie, just nice and easy. Good. A lot of times we do that standing portion with a little bit more intensity. So we'll have Annie go back in one more time to child's pose. We normally hold this for 15 seconds or so. And then after we do the stretching portion 3 or 4 times, so this would be the second time for Annie being in this position, we then will have her do what's called shooting her hips. Well, she'll push her hips forward to engage her glutes and abs at the same time and raise her arms up to get her spine straight. And this will help to create some intensity where her glutes are on and her abs are on, which is gonna unload the low back. One more time, shoot your hips. Boom, hips go forward, abs are tight, glutes are tight, low back is out of the mix. Good job. So that is how we take care of low back pain, glute pain, high hamstring pain, and it puts us in position to get more flexible through the posterior side of our body between our rib cage and our knees.